Dr. Kelvin, as usual, in his very suave, chic style. He's sitting there on the set with Frema as well. Frema, why? What's the problem?
It wasn't your responsibility to intro Dr. Kelvin.
Okay, please do the introduction.
Doc, you didn't hear any of that. Hi, Dr.
I was even surprised.
Can you imagine what kind of institution is that?
Sitting here and then, I mean,
Can you imagine? Sir,
what is this?
But I'm taking the viewers to the set.
Who told you to take them to the set? Who told you? You now, you're coming to perch on the set.
I don't need to be
Take your taking them to the set back. Take them back. Hi, Dr.
Hello,
Kelvin.
Firma.
How are you?
I'm very well.
Today you are in your uniform.
Yes, because we are discussing a very serious issue, so we have to, be ready to
Hemorrhoids.
help. Yes, hemorrhoids.
Ooh, tell us about that.
So hemorrhoids are actually quite common. In fact, and I realized that this might not sound right, but it's actually more common in men than women.
So why doesn't it sound right?
Because most people would have
Should it be common in women?
Actually, yes.
Why?
Yes, because there are certain things that predispose women to hemorrhoids that men don't go through.
Okay.
Typically, pregnancy. Because, and I'm sure we'll talk about it in more details, but anything that increases intra-abdominal pressure will predispose you to getting hemorrhoids. And so how often you raise that intra-abdominal pressure, it puts you at risk. So women who get pregnant multiple times, especially if they carry to term, and then the whole process of delivery, spontaneous vaginal delivery, increases the pressure in that area, so puts them at risk. So you'd have expected that more women will actually have hemorrhoids than men.
Well,
However,
this is where God is God, and not a scientist.
I know, right? However, it's more common in men than women. So the why is interesting. I mean, there's really no established why per se.
Yeah.
But, I mean, I'm thinking about it. It seems as if men tend to spend a lot more time sitting on the loo.
Okay.
Really?
Yes, actually.
Okay.
If you actually follow a lot of discourse, you realize that men tend to use in fact, there's a meme on social media that talks about why the loo is called the restroom. Because that's where men go to hide from everything that's happening around them.
To make phone calls and
exactly,
stuff like that.
and catch up on
messages
things.
like that.
To rest.
To rest, Frema, to rest.
I miss other things.
Rest.
I miss other things. Or could it be that men get more constipation than women?
So again, that's also an issue. So men tend to, indulge in heavier lifting than women.
Yeah.
Look out there. A lot of the manual work is done by men. Even the heavy duty trucks, most of them are being driven by men. And even though they are, and even at the gym as well. Exactly.
Exercise.
So men go through a lot more things on a more consistent basis. I mean, how many times can a woman actually get pregnant in their lifetime? Versus somebody's daily bread. So if the person is probably a manual worker or a heavy duty truck driver, and by the time he takes 110 on the steer, Charlie, the amount of energy he needs to generate.
So it's really about the intra-abdominal pressure.
Yes.
Yeah.
Yes.
That's really what it's about.
It is. I mean,
forcing down
exactly.
the rectal inner area.
So how many times or how often you engage your abdominal muscles will increase your risk of developing hemorrhoids over time. It's because you have to understand that, or let's take it from here. Everybody has something called a hemorrhoidal cushion.
Okay.
Which are blood vessels. And hemorrhoids are really blood vessels. They are blood vessels around the anal opening. So they are around that area. And some have said that they provide some support to the continents. The muscles over there are supposed to keep the place closed until you're ready to poop. So that things that just don't be coming out at will. And the hemorrhoidal cushions support that function. Okay. Now, every time stool is coming out, it's sort of rubbing against the hemorrhoidal cushions, as they come out. And so over time, the cushion gets a bit lax. So it begins to drop as things are coming out, and eventually some of them might come outside. So there are actually two types of hemorrhoids. There's the internal hemorrhoids and the external. Okay. Internal hemorrhoids are usually, there's a certain line in there. We don't need to get into details, but those hemorrhoids are above that line and they typically will not show on the outside. Okay. And then there are hemorrhoids that happen below that line, which will typically then show on the outside. So you can see an image over there, which is trying to explain the two types of hemorrhoids, so the internal and the external hemorrhoids. So as I said, everybody pretty much is at risk of hemorrhoid because we all have the hemorrhoidal cushions, But depending on how much of the intra-abdominal pressure you consistently expose yourself to, then your risk increases. You know, so a man who is maybe a manual worker, always lifting things, you know, is at risk. And you know, typically most of us, we don't actually assume the right posture, and we don't use the right gadgets to protect ourselves when we are lifting things. And we go to the gym. People think it's actually cool to lift weights without a belt. You see, but the belt actually plays a very, very important role. So it tries to reduce the pressure on the groin area as much as possible, because related to hemorrhoids is something also called a hernia. And even though they have different pathophysiology, they are related in terms of what predisposes you to them. You know, so once you're increasing your intra-abdominal pressure, your risk of hernias and your risk of hemorrhoids go up as well.
Can anal sex aggravate your risk?
Yes, it does. Anal sex actually puts you at risk of hemorrhoids.
Why do you laugh?
From my life, controversial things.
No, it's not controversial. I mean, you know, well, we need to know as we learn it. So that when you are doing stuff like that, already you know what will happen. So maybe you take your drugs even before you start.
So yes, anal sex actually puts you at a higher risk
the way Roger was laughing.
of developing hemorrhoids. Yes, so it does. I mean, because again, you are irritating the cushion. You know, and now it's more of a should I say, this is morning TV, so I don't know how to explain it, but there's more irritation than just your regular stool coming out. You know, because stool comes out in just one direction. You know, but now in this case there's a whole lot of opposite direction.
Dual courage.
Exactly. So the irritation is a bit more.
Going and coming.
So Dr. Calvert, are there disease conditions that predispose you to hemorrhoids, or is it just a physical action? So
yes, there are disease conditions that predispose to hemorrhoids. I mean, let's start with some of the most common ones, like a fibroid, for instance. You know, fibroid, for a woman, fibroid sits in the pelvis, you know, quite close to, I mean, the anal region that we are talking about. Fibroids tend to come with additional weight.
Okay.
So that is increasing the pressure inside that area. So it could actually cause that. People who have chronic constipation can also be predisposed, because if you're going to sit on the loo and you are chimming
for 3 days,
you are chimming.
You are there.
You know, straining a stool, you know, increases the pressure further, and so I mean that can predispose you as well. Interestingly, people with chronic diarrhea also are at risk of hemorrhoids, you know, because again, it's pretty much the same thing, but instead of straining now, there's a lot of
aggressive evacuation.
Exactly.
Forceful aggressive evacuation.
And that increases the intra-abdominal pressure as well, you know. And people who have liver disease, especially liver cirrhosis, there's something called portal hypertension, you know, where hypertension means increased pressure in the blood vessels. But when we mention hypertension, typically, you're talking about the arterial system, you know, when the heart pumps. But portal hypertension is on the opposite side, on the venous side. You know, so the blood returning to the heart, there's increased pressure there. You know, and you know the hemorrhoidal cushion, as I mentioned earlier, they are veins. So once there's increased pressure in the venous system, then that pressure can also cause you to develop hemorrhoids as well. So people with liver disease, so in fact, somebody comes in with hemorrhoids and there's really no clear history. These are some of the diseases that we have to investigate for. Some cancers also, I mean, cancer in the colon can present as hemorrhoids. So when somebody comes in with hemorrhoids, looking at the age, looking at the history, these are some of the things we look out for, because it could just be the signs that's
something bigger,
of something far bigger. So I mean, if you have a hemorrhoid and you're sitting in the house, don't just be thinking that it's just a hemorrhoid. No, it's not just a hemorrhoid. It could be a sign of something more sinister going on. So you do need to go in for a checkup.
How long would you have or host a hemorrhoid for before you feel like, you know what, this thing's becoming critical, I need to go get checked?
You see, as it is with almost every disease condition, what you see is not usually what the reality is. You know, so you can't say that because I've only noticed this hemorrhoid for 1 week, I'm going to sit down and observe it some more. It doesn't really work like that, because you have to understand that it might have been there silently for a while before it started presenting itself. And then also most people don't even know the signs of hemorrhoid. So even though it might be there, they might even miss it. So if you see you're going to wait, let's say a duration, no, we don't advise that at all. Once you notice anything out of the the ordinary, you need to come in for a proper evaluation so that we know what we are dealing with today, and whether it is just a hemorrhoid. Because if it's just a hemorrhoid, there are treatment options available. And if it's not just a hemorrhoid and you just go and treat the hemorrhoid, then the main thing is still there causing it. Exactly.
But you mentioned that we have the internal and the external one. How would you know that you have an internal hemorrhoid?
Okay, so the commonest sign or symptom of the internal hemorrhoid is just bleeding, and this bleeding tends to be painless.
Okay.
You see, it tends to be painless, and it tends to be bright red. Now, the color description is very important because, I mean, it's not all blood is blood. You know, depending on the color of the blood that you are bleeding, it helps us to localize where the problem is. So this bleeding tends to be bright red, and it tends to be painless, you know. And usually you'd find it, most people would actually see it after they've used the washroom and they are cleaned themselves, then they might find streaks of blood in the toilet paper. Or they may just get up and they notice blood in the toilet bowl, you know, because it's painless, so you really don't know what's happening there. Now, this bleeding can be just drops, or it can actually, exactly, you know, so it can be severe. I have seen people with hemorrhoid coming into the emergency room, literally white, you know, like, yes, that's how bad it is. In fact, for a man, one of the commonest causes of anemia is actually hemorrhoid, bleeding hemorrhoids for males. I mean, women have their own issues with bleeding, but for men, one of the commonest causes of anemia is actually hemorrhoid. So if a man comes in with unexplained anemia, you want to check for a hemorrhoid because it could be the thing that's affecting
How do you
him.
treat this? You know, a lot of people go for traditional medicine, buy something on the bus and all that in the name of we are treating all this.
This bus matter.
Yeah, but it is a reality. People are still doing it, you know.
It's
how
true.
do you deal with this? How do you treat it?
So let me take that thing from that question from this angle. Now, once a hemorrhoid develops, it's going to progress. You know, it's going to get bigger and bigger. It's going to keep hanging. So when it starts, most of the time, maybe if it's a stage 1, you may not see anything outside. You know, you might notice the bleeding, you know, but you might not see anything hanging outside. When it goes on stage 2, stage 3, it might come outside, but it goes up by itself. You know, by the time it gets to stage 4, it's going to stay out. It will never go back inside. You know, and then if it starts getting complicated, it can get ulcerated. Also, ulceration means that it can get a cut because now it's hanging outside. You know, so it can get a cut, which can cause bleeding. It can get thrombosed, and that is excruciatingly painful. You know, thrombosis means that the blood that would have been moving in and out is not moving anymore. It's stuck, and it has formed a plug. And that is painful. I mean, you can't sit, you can't stand, you can't lie, you can't do anything.
But if it forms a clot, that means it's going to block also oxygen flow to the area.
So yes, but thankfully, I say thankfully because these are not on the arterial side; these are on the venous side. You know, so the blood has been used up already. So it doesn't cause as much damage in terms of oxygen, but it still causes a lot of problems. You see, because infection can also thrive in that environment. So you know, it's a very, and you have to understand that because it's the passage for stool. Stool has a lot of bacteria, so infection is a big challenge when you are dealing with hemorrhoids. You see now I was making a point that once it starts going to progress, you see, so the treatment we need to move a little quicker. You know, so when you come in for the assessment, you'll be assessed probably. We know which stage it is. There are various treatment options. Some of the treatment is conservative with medication, with lifestyle changes, but ultimately the treatment that the gold standard is actually surgery. You need to remove it. You know, but this is where the challenge is. Somebody may have done surgery in the past, and then the hemorrhoid recurred. Now we have to understand that the Cushing's are there are a lot of different vessels in there. The fact that you removed this hemorrhoid does not mean that you have removed all hemorrhoids. You know, so another hemorrhoid can develop again. That is why the lifestyle modification is important, and means that you need to eat properly. You need to avoid heavy lifting if you can. If you cannot, you need to use the right posture or the right support, because if you are going through the same things that put you at risk of the hemorrhoid in the first place, it's not surprising that it has come again. Now, because of this risk of recurrence, some people, you know, go around making the case that if you go and cut it, it will come again. So people avoid the surgery. But surgery, like I said, is actually the gold standard. And there are different kinds of surgeries, different success rates. I mean, you need to go to the right place to get the right surgery. You know, and so people are doing all sorts of things to try and treat their hemorrhoids, and it's not going to work. It's going to progress.
If you do the prescribed lifestyle changes, can your hemorrhoid recede and not recur?
So no, that's why I stress on the fact that once it starts, it will progress. Because the thing is, you're not going to stop pooping anytime soon. You're always going to poop. But now the question is, are you going to sit on the loo 15, 20 minutes, 30 minutes? Some people actually sit on the loo for 1 hour. Or are you going to now reduce it to 5 minutes and get the business done and go away?
Which sometimes you don't have control over.
Well, no, staying on the loo for 1 hour, that's...
No. What I mean is deciding how quickly or...
Well, you do. And this is what I mean. You see, if you have the habit of going to the loo with your phone, then you know that whatever you're going to do there, you're going to spend more time that you need to be on the loo. And keep in mind that the loo, the toilet bowl is designed in such a way that there's an opening at the bottom. You see, and so the way you sit, once you sit on the toilet bowl,
Pressure is developed.
the pressure has already created, and then there's a vacuum kind of system created to which is literally pulling you in, and that's gravity. So long as you remain seated in that position, gravity is going to keep acting on the hemorrhoidal cushion. It's going to keep pulling them down because there's nothing supporting them from the back. You know, and this is actually one of the arguments against. So when I use hemorrhoidal cushion, I'm talking about the blood vessels.
Yeah.
But there's also a product called hemorrhoid cushion, which is a donut-shaped cushion for people with hemorrhoids, especially that are causing pain. So they sit on the donut so that nothing.
It supports.
One of the arguments against that is also that because of the hole in there, you continue aggravating the situation that you are trying to resolve. You know, so we actually don't like it. You know, but of course, when you're in that severe pain, in that short period of time, it might be something that can help you, but in the long term, it's not advisable.
So just go in there, do your business, and
get out.
of the
Exactly.
place, you know. Don't carry newspapers and magazines and a list of all the things. Go and do set your Google stuff there. You know, for 3 days you are still there. Please, you are causing so much harm
It's
to
a
yourself.
place that people just love to sit and read and all of that.
It's true.
Especially when the washroom is comfortable.
Yeah, but I don't know. I never developed that habit of spending a long time there. In fact, as I grew older, I've rather tried to see if I could, spend a little more time there. Yeah, I know, because I didn't do as a
As for
habit.
that phone, I'm guilty. You know, sometimes you even finish doing the business and you even forget and you are still very comfortable.
Exactly.
Scrolling
Exactly.
through and
Exactly.
Sending emails, doing all stuff so that I carry my coffee there.
And so the thing is, so if you have taken off a hemorrhoid and then all these habits are still there, then it cannot be surprising when another hemorrhoid pops its head.
Up.
You see, because like I said, lifestyle is important, and then your diet also very, very important. If you are eating processed foods, your risk of constipation is higher. You know, so you need to make sure that you are adding a lot more fruits.
Fiber.
Fiber. You know, we bastardize Gary, but Gary is rich in fiber. So let's add some more Gary to our diet.
Gary is one of my favorite staples.
Thank you very much. How do people get in touch with you?
Yes, I'm active on social media, Kelvin also MD. So you can link up, and also follow my clinic page as well, Crown Health International.
Fantastic. All right.
Thank you very much.
Yeah, absolutely. This is a great conversation, and it's important not to just watch, but also make the changes that are necessary.
Don't carry your phone to the washroom.
And don't make a cup of coffee and go and sit there either.
Why are you shaming people?
Dr. Kelvin Owusu is the head of occupational health and wellness at the Clarion Health International.